Most of the studies were looking at regular dental images, regular x-ray images, 2D pictures, which hide a lot of information. So in order to capture this image, you're having to take the x-ray beams through really dense parts of your jaw. So you can have a hidden infection there for many, many years and never even know about it.
Wow.
So the major call to action is, if you've ever had a root canal treatment or extensive dental work, is to have a 3D cone beam CT scan. This is really critical because you can find hidden infections earlier than you can with a regular x-ray. So success has generally been looking at regular x-rays and lack of symptoms.
Yeah.
You know, but the problem is half the time these are chronic silent infections. You don't know there's a problem. People are shocked when they come in. They didn't put it together. Oh, wow, my chronic sinusitis, oh, well, this is from a root canal infection that's just blown through the floor of your sinus and is just constantly draining into the area.
Totally. And you know what's funny? It's like a guy like TJ who has like very thick bone density. You could have an issue and you have thick cortical bone and thick cortical bone in between infection, and then that 2D x-ray slams it together and we wouldn't see it. But then like I have menopausal women who start to lose bone density and all of a sudden their root canals are failing. It's like, no, the root canals are not failing.
It's always failing.
We just now see them because you lost some bone density. So it's a really good point that you bring, that like, especially now, I think CBCTs, which is the 3D scans, are standard of care for sure.
So I can't give numbers.
Yeah.
But there are a lot of things that we can do now, really cool tech that we've implemented in Integrative Endodontics to check on them. One, we do the cone beam CT scans at their recall, and then we schedule them out every 2-3 years based on their history, based on maybe their genetic profile. In addition, we do testing around the tooth itself, and we're looking for MMP9. This is an inflammatory signal that our body creates. So we test the tooth that had the root canal treatment, and then we test a tooth that's vital, alive, on the opposite side of the mouth that doesn't have the root canal treatment. And we can compare these numbers.
So how are you testing it?
We're taking little sterile pieces of paper that come in the kit and basically putting them right around the tooth where the fluid comes out of the tooth. And so we're looking for numbers to be more elevated on that tooth. And if it is, then we take a step back. Okay, let's take a closer look. So these are some of the things that we do.
I think 99, maybe 99.9 out of 100 dentists are not doing that.